Let's talk about a powerful imaging tool you probably associate with hospitals, maybe a knee injury, not so much with dental work. But what if I told you that MRI technology is finding a really crucial role right there in the dentist chair?
Oh, yeah, we've all been there, right? You're in the chair, they drape that heavy apron over you, you gotta bite down on that little cardboard tab, hold perfectly still, hold your breath, and you hear that quick beep. It's the standard, the absolute go to diagnostic tool for dentists everywhere. And that's the big question for today. What happens when that x ray comes back totally clear, but you're still in pain? What if the real source of the problem is hiding in plain sight, just invisible to the usual methods? Okay, so to answer that, we first have to give credit where credit is due and really appreciate what standard dental imaging does exceptionally well. And what it does is see the hard stuff. It is the absolute master of seeing bone and teeth. I mean, just look at this list. This is how powerful these standard images are for hard tissues. We're talking about everything from simple little bite wing x-rays to really advanced 3D scans, like a cone beam CT, which is kind of like a mini CAT scan just for your jaw. All of them are just incredible at visualizing bone and teeth. They can spot those tiny cavities hiding between your teeth, show bone loss from gum disease, and they are absolutely essential for planning complex stuff like dental implants. Basically, what these tools give your dentist is an incredibly detailed map of all the hard structures in your mouth. You can think of it as the architectural blueprint of your entire jaw. But here's the catch. That blueprint is missing some really key information. It doesn't show the whole picture, and this creates a pretty significant diagnostic blind spot. And this is the exact question that can drive both patients and dentists crazy. Your teeth look fine, the bone looks perfectly healthy on the scan, but the pain is still there. Well, that often means the problem is actually in the soft tissues, which, you guessed it, traditional x-rays just can't see. And this slide really nails why. See, both x-rays and CBCT scans work by passing radiation through you. They're fantastic at showing dense things that block that radiation, like bone. But things like muscles, glands, the cartilage in your jaw joint, or, and this is a big one, the fluid and inflammation that scream, there's a problem here? To an x-ray, all of that just looks like a vague gray blur. The actual source of your pain is effectively invisible. So, to see these invisible soft tissues, we need a completely different kind of technology, one that doesn't rely on radiation at all. And this is exactly where magnetic resonance imaging, or MRI, enters the picture. The technology is just fundamentally different. It's night and day. Instead of shooting radiation through you, an MRI uses a super powerful magnetic field and radio waves to essentially talk to the water molecules in your body. And since different tissues, like muscle or cartilage or fluid, all have different amounts of water, the MRI can listen to their unique signals and build an incredibly detailed picture. This whole process allows MRI to create these amazingly detailed pictures of soft tissues and organs with a kind of clarity that radiation-based imaging just can't hope to match. Oh, and the huge bonus? It does all this without a single bit of ionizing radiation. Now, this is where it gets really cool. Radiologists can actually tune the MRI to highlight different things. So a T1 weighted image is fantastic for showing the basic anatomy. It makes fatty tissues show up as bright white. But then they can switch to a T2 weighted image, which makes fluid light up like a Christmas tree. This is the absolute key for spotting problems, pathology, like inflammation. A simple way I like to remember it is T1 for anatomy and T2 for trouble. So where does this amazing technology actually fit into the world of dentistry? Well, its main role, its absolute superpower, is visualizing one of the most complex and frankly trickiest joints in the entire body, your jaw joint. And hey, don't just take my word for it. There's a really strong clinical consensus on this. This quote from our source material makes it crystal clear. When it comes to getting a complete picture of the temporomandibular joint, or TMJ, MRI is the gold standard. Why? Because it sees everything, both the bone and all the important soft tissue around it. So what can it see specifically? Well, an MRI can show the exact position of that tiny little articular disc in your jaw joint, which is a super common source of all that clicking, popping, and pain. It can see fluid buildup, that's called effusion, which is a telltale sign of inflammation. It can even see swelling inside the bone itself, that's bone marrow edema, which indicates a stress response that would be totally 100% invisible on an X-ray. This really shows how MRI fits perfectly into a logical diagnostic process. It all starts with a clinical exam. If your dentist suspects a TMJ problem, they'll often start with an X-ray or a CBCT scan. That's step 2. Rule out the obvious hard tissue problems like a fracture or arthritis, but, and here's the key, if that comes back clear and the pain is still a mystery, that's when you move to step 3. The MRI is the next step to get that high-definition look at the soft tissues and finally pinpoint the problem. So, when you boil it all down, it really brings us to the most important takeaway. Modern diagnostics isn't about one tool being better than another. It's all about choosing the right tool to answer a very specific question. This summary table just lays it all out perfectly. X-rays and CBCT, they are the undisputed champions for hard tissues, using radiation to diagnose things like cavities and fractures. MRI, it's the champion for soft tissues, using those magnetic fields to diagnose really complex issues in the TMJ. See? They don't compete with each other. They complement each other. They're on the same team. Let's be clear. The dental X-ray isn't going anywhere. It is way too valuable, too efficient, and too essential for everyday dentistry. The best way to think of MRI is as a specialist, a consultant that the dentist can call in for the really tough cases, the ones where that standard blueprint just isn't giving them enough information. It's all about completing the picture.
And this leaves us with a pretty fascinating thought to end on. Technology is always moving forward. I mean, we've gone from blurry films to incredible 3D scans, and now to this high-definition soft tissue imaging. As these tools get even more powerful and precise, you just have to wonder, what other hidden sources of pain will we finally be able to see? And what new solutions will we find for problems we don't even know exist yet?